TNO, researchers are working on all kinds of unique innovations every day. I visit them to hear what they have come up with and what their work means for society. I'm on my way to Shavini. Shavini is a time setter at TNO who really sets her mark on our time with her innovations. Shavini develops wearable devices. She integrates small sensors into body patches that you can wear. Doctors use this to monitor your health. Super interesting. Hi Shavini.
Hi Camilla.
Can you show me some examples of wearable devices?
I can indeed. So we have wearable devices that are out there that can measure your heart, such as these types of things. They can also measure your breathing rate. We have wearable devices that can measure your blood pressure.
Wow.
And also those that can measure your oxygen saturation.
And some of these things a smartwatch can do too, right?
That's true. But the smartwatch, unfortunately, does not have the same capabilities as these wearables. The possibility for good close skin contact is essential. You need to also have the correct location. You can't get your heart rate as efficiently, let's say, from your wrist compared to your body. And then also the sensors that we use, they're higher quality.
And you make all of these things yourself?
Well, what we do in the wearables team is that we integrate. We integrate the correct types of sensors within a stack buildup such as this. And each of these layers has to be correctly chosen to make sure that you get the correct type of signal quality that you need.
And what does this do exactly?
So this is a wound monitoring sensor.
And how does this help the patient?
Well, you have wounds out in the population that are very hard to heal. Patients that have a problem for months to years. And currently you have nurse practitioners that base their decisions by visual observation and touch. What this provides, and these two different concepts, they provide you with a tool to give you real numbers about how your wound is doing over that time frame. And you can also get 24/7 care. So something a nurse cannot do is provide you with really when an infection is going to come at an earlier point. An alarm could then ring and then indicate that you should go to the hospital.
So this actually really improves healthcare.
Not only that, it should also be saving on time. And how it does it is because you will have less checkups that you need to do. And also, if you can detect an infection earlier, the severity of the infection's causes, side effects, are a lot less. So you then have less need for severe treatments for that patient.
And how is the data actually transferred?
So you can do it in multiple ways. You can use antennas such as this and take a snapshot of a recording, or you can use Bluetooth for continuous monitoring.
Is it challenging to make those devices?
So luckily I have a team behind me that helps us work on these types of wearable devices. We use hybrid printed electronics, which is giving it the properties of flexibility or stretchability. And we look at the build-up for comfort and wear. So how does it stick to your body and how does it give you the freedom to carry on living your life?
That's really fascinating. Thank you so much. Wearable devices with tiny sensors that can monitor your health. What a great idea.